The fear of COVID-19 early last year would propel technology to new heights as world over, populations would seek ways to minimize interactions that would lead to the spread of COVID-19. Even so, the healthcare system would end up suffering the most in the period, and so was businesses. But for Madbook, a digital medical firm, it sought to use its platform to its benefit.
And now with COVID, the idea that there could be teleconsults, the idea that there could be home visits by doctors, that is something that propelled us. But it's just a matter of just helping people think. Now COVID, with people being isolated, people on a lockdown, they were able to embrace the idea very easily because they saw there was no other way.
The firm that came into being in 2014 has been on the forefront to edge out analog ways of acquiring health services by acquiring innovative solutions through mobile apps.
And the biggest gap that we bridged was the idea that now your medical records can be at the palm of your hand. Okay, even for myself, before I started using the Madbook app, I had my medical records scattered in a variety of hospitals across Kenya. But now, since I'm using the medical app, I can actually see what was ailing me last year at a time like this. Okay, and even when I go see a doctor tomorrow, I will tell you, but these are my previous medical records.
One of the firm's app, Med360 Plus, a health management information system HMIS, seeks to offer a variety of services that will help ease patients' mobility and access to health services that includes patient tracking and drug management to lab work as well as billing and finance. The system can also be accessed on any other facilities by giving signatory access. But how does the future of technology look like for the health sector? Oscar Githinji, the general manager, says it is a matter of time before health facilities are brought in homes.
Once we roll out things like 5G, we're going to see people getting even surgeries from other countries and they're being done locally. We're going to see the uptake of wearable health devices that can communicate your heart rate, can communicate your fever, your temperature to now our apps and actually predict before you actually get a disease.
With its inbuilt analytical tools, Nganga says it will be easy for doctors to study and diagnose diseases using the very same platform.
The data is encrypted on the software. So even I, working at Madbook, never know what is ailing a member who is on a particular format because the form of the data that is already encrypted. So the only person who has access to the data is the patient. Okay, so it's even for when you go see a new doctor, for the new doctor to have access to your medical records, you have to initiate the sending to that particular doctor.
The management system, they say, is available in all the 47 counties in Kenya, while 32 counties are on health management system with the application availability entrenched on Play Store. Martin Opio, K24 Business.